Just going to motion out here, cross the arms over the shoulders, and this is static palpation, feeling for restrictions, and the patient, if it's tender, will usually feel the tenderness and they'll tell us. Just go through, and then we take it through the ranges of motion in the spine. So this is called lateral flexion. We're going to the right, feeling on the spinous processes. We can also feel if the muscles tight. And we go to the right, sorry, the left. Again, taking it to joint plate, and then rotate. And is that okay? Good. Just getting a general feel, and then rotate to the left. Okay, and relax, let it go. Hands please down by the side. Check out as well the neck. This is again static, we're palpating with the fingers. Just feeling through there.
This is where I get really sore through my neck.
And it's a little bit sore, the patient's sore through the neck. So we'll check this one out. Okay. And then if you can lie on your front, we'll just check that. So face down please, just on here. And we're just going to go through with the patient lying on the front, and we're just going to feel through certain areas in the spine. So we're going to press. So it's these areas here. As I go through, I'm going to be pressing on the right side, so the sacroiliac joints, and that static palpation over. We'll go through each of the spinous processes as well as we go. And that's just pressing on and asking if there's any tenderness. We can also feel if there's any restriction as well, all the way through. Okay, is that okay?
Yeah, it's okay. It just feels really stiff and it's sore through there.
Okay, so what we'll do is we'll just get you to turn onto your back. So turning onto your back. We're going to adjust the neck area. Okay, when you're ready. So just start off with just gently massaging it a little bit, just get rid of some of the tension. And again, it's using the fingers, the massage techniques, kneading and a circular movement. Close the eyes if you like, it might be a little bit easy to relax. And then to the other side. It's very tight. So usually that's the case if the joint's restricted as well. Usually there's some tightness. We're going to use a high velocity, low amplitude thrust to adjust this area. Just take the joints through, again keep the eyes closed and just relax into what's called a lockout, and relax, drop the right shoulder and let it go. That's good. And well done, that's very good. Okay, just relax, let me just gently massage it out. Sometimes it's a bit uncomfortable, some people don't like the idea of people doing adjustments on their neck if they've never been to a chiropractor. The first time you come in, it can be quite frightening. But really, there's nothing to worry about as long as you've been assessed properly. And let's get you to now stand up. There's another area in the top of the thoracic spine that we're going to adjust. And just so that you know, that area is here, so it's quite locked in the cervicothoracic junction. It's about T123, so we're going to adjust in this area. There's a special technique that we use, and it's only chiropractors or manipulative therapists that can actually do this, so please don't try it at home. This is just so that we can see what we're doing. So if you please stand up and turn to face that way, interlock the fingers behind the head. We're just going to put this over the area, bring the elbows together and bring them together, squeeze the arms together. Let's take a breath in and lean back a little bit, take a breath in all the way and out all the way. Well done, okay, very good. Okay, so that's excellent. Let's get you now please to turn onto your side facing this way. Okay, that's fine, you can stay there. No, that's fine because we have to do that side. So I just need to lower the table, you can relax. Straighten this leg for me. Top leg bent. Come round. Alright, okay. So again, hands on the side. So again what we're doing, just so you know with the spine, we're going to do the right sacroiliac joint, so we're going to use the pisiform contact, and we're going to do this chiropractic adjustment to help free up that area. The patient's lying on the side, it's pretty much like that without the bone and the muscles and the skin there. So just bring them up into the lockout.
Got fat as well.
Okay. And just relax. Okay, well done. Good. Excellent. Okay, and then turn on to the other side. With the other side, there's an area in L3, so in lumbar vertebra 3, the third segment here, we're going to use what's called a push-pull move. Slightly different. Are you okay?
Yeah, do I still do the
Excellent,
same
that's
thing?
fine, yeah. So hands on the elbows, top leg bend, let's lift up a little bit. So we're going to block with one hand, with the other hand we're going to pull across. Just pull down, just relax. That's good. And breath in, and out all the way. Excellent. Okay, let's get you to turn onto your front, face down, and just check out that thoracic area once more, just a bit in the middle. And it's just the last little area through the mid segment here, so it's around about the 8th thoracic vertebra. So we're just going to use a bilateral thenar contact, and get the patient to breathe in and out all the way, and relax. That's it. Excellent. Okay. So then, if you can please sit back up. What we've done, if I recheck out the patient, is we've basically adjusted the cervicothoracic junction up here about T23. We've done the mid-thoracic area where there's a bit of joint restriction, the joints aren't moving. We've done a push-pull move on the L3 area on the left, and then on the right sacroiliac joint we also moved that. If I go back and I check out, hopefully we've found that there's an increased movement. And again, once again, thank you very much for allowing us to have you help us with this particular part of YouTube.